Now we're going to go to SSM Health to see firsthand how medical surgery nursing provides critical care in all sorts of situations in the surgical rooms. Let's go inside SSM Health.
Huddle at the front hub. Hi, I'm Allison, nurse manager at St. Louis University Hospital on 5 South. Good morning, everyone. I did want to give kudos to Florence, Joe, Aaron C., Tabitha, and Sylvia. A patient gave them a shout out and said I would recommend this hospital because of the service that was provided and how smoothly my surgery went. Any questions, comments, concerns about anything? Okay, that's all I have. Thank you. Good morning. This is Kaylin. She's going to be your nurse today. She will go to surgery at noon. Do you have any questions about your care today?
No, you've been wonderful. Thank you so much.
Oh, you're welcome. You're in great hands with Kaylin.
Hi, I'm Kaylin. I've been a nurse at SLU for a little over a year. I was actually a care partner here for a year before that as well, so I've been on the same floor for 2 years. SSM Health is in 4 different states, has 23 hospitals, and over 40,000 employees. Some of my responsibilities as a nurse are assessing my patient, monitoring for changes, administering medications, keeping them safe, and promote healing. After I graduated from college, I was in some online classes, had a few days of classroom training, and then I was on the floor with a preceptor for 10 weeks until I was comfortable enough being on my own. So there's a few things I love about my job. The first one is the relationships I've been able to build with my coworkers and my patients. We have a very diverse population here at SLU, and you get to learn a lot about different people and the backgrounds they come from. I love being able to be a light in someone's really hard time and being able to help them through that.
Hey, Kaylin.
This is my friend Rhea.
Hi, I'm Rhea. I've been a nurse for 7 months here at SLU Hospital. I went to Gold Farm Nursing School and I'm a new grad.
So Rhea, what do you like about being a nurse here?
Honestly, I love working night shift. Everyone here is just amazing and the culture is amazing as well.
Yeah, the teamwork is indescribable. The way we all are so eager to help each other makes a huge difference. We all have been learning and growing together, and we all became really close friends too.
I agree. Even the teamwork with the doctors, respiratory, phlebotomy, the care partners, and as well as the nurses is amazing here.
For sure. Gotta go.
Working on MedSurg is taking care of 4 to 5 patients for 12 hours. I monitor them, evaluate them, pass medications, work with different team members like doctors and respiratory. It's very hands-on. There are so many opportunities in nursing to grow as a leader and as a nurse. You could precept and orient, become a charge nurse, a manager, or even move floors and specialties in nursing. Hi, this is my friend and coworker.
Hi, my name is Casey. I've been a nurse here at SLU for 3 years.
So what made you want to be a nurse?
I wanted to be a nurse because I wanted to help take care of people and just make a difference in people's lives.
I agree. Patient care is so amazing and it's so fun taking care of people and then helping them and seeing them get better.
I chose SSM Health as a career path because I knew there was a lot of room for advancement and I would be working with some of the best nurses and doctors in the area. One of the most important things you can do as a nurse is advocate for your patient. Communicate with your patient and listen to them, and then express their needs to the care partners and the doctors so that they get the care they need.
St. Louis University Hospital is a 356-bed academic level 1 trauma center. We take care of the sickest of the sick. We are a big hospital with a small town feel. As a high school student, I think it's really important to get involved with SSM Health's shadowing and volunteer opportunities.
And now joining us live from SSM Health is Sam Kohler, Clinical Director. Sam, welcome to the program.
Thank you so much, Brian, for having me today. I'm so excited to talk about SSM Health and all of the opportunities that we have here.
Excellent. Well, I'll let you have the operating room floor, and then we do have some questions coming in right now.
Perfect. Well, I just want to once again thank everyone for participating today. It's really great to see all the interest that's here in healthcare in the Missouri region. SSM Health is a Catholic non-for-profit organization, and we work to make sure that we make a change in our community daily. We were founded by several Sisters of St. Mary, and they actually came into the St. Louis region to start caring for smallpox. And they were the only ones that were willing to do that care. And that is the same mission that drives us every day to continue to provide care to those that others will not. And so we work very diligently to kind of hold those values of the sisters and do that in our work every day. In the med-surg nursing profession, some may not be familiar with the types of patients that they take care of. So they take care of pre-surgical patients, so before they go to surgery, post-surgical patients after they go to surgery, as well as other disease processes, so respiratory infections, kidney disease, and they get to take care of that entire gamut of patients. And so it's a really great place to lay that foundation if nursing is an area of interest for you, because they will be the best nurses in the hospital because they deal with so many different types of patients daily. No day is the same. Every day is different. And that's what's really exciting about this space.
Excellent, Sam. And we actually have some students coming in now. I believe Fulton High School, the Hornets are flying in as we speak. And so if you could go ahead, Fulton High School, unmute your video and your sound, and you'll go live to ask Sam a question. Hi.
Hi. Hey, so we actually have several kids over here. You can't really see them, but we wanted to know, what is a level 1 trauma center? What is a normal nurse schedule like at SSM, and the favorite part of a nurse's job?
Great questions, Fulton.
So a level 1 trauma center means that we are able to take care of patients after a certain type of event. In a level 1 trauma, they can take care of major motor vehicle accidents, things along those lines that cause multiple traumas to the body. In those settings, you need to be able to act very quickly. You need to have certain items available to you right away in order to save that patient's life. And so a level 1 trauma center means that EMS will bypass other facilities to bring us the most critical patients because we have the equipment and the ability to care for those sickest of the sick. When it comes to, nursing, what that regular schedule looks like, it can change depending on what department you're in. For the most part, most nurses work that 3 12-hour shifts, usually a 7 a.m. to 7 p.m. or a 7 p.m. to 7 a.m. But we do have multiple departments who also work clinic type hours of that 8 to 5. And we always offer, flexibility in that scheduling. SSM actually has several positions that are highlighted as a flexible option. And so they do have the ability to do 4-hour shifts, 8-hour shifts, 12-hour shifts, full-time hours, part-time hours, as well as PRN hours too. We actually have an externship that's for our students that we know are in nursing school, because nursing school can be kind of complex in scheduling. And so we wanted to have a position available that was incredibly flexible, but also allowed those nursing students to get that time in the hospital and still be able to, gain some of that knowledge without putting an extra stressor on their schedule. So we have multiple options here for that. I think the most rewarding part of nursing altogether is just being able to see that what you do daily makes an impact for someone else. None of us get into nursing for the money, for the schedule, or anything along those lines. We get into nursing because we want to care for people. It is a very rewarding place. And there's a phrase we like to use where it fills your cup, per se. And so every day you come in, you are able to kind of walk out with a sense of pride, knowing that you made an impact on somebody's life.
Right, is that you made a difference in somebody's life and you made their life a little bit better by your encounter with them. So, Sam, we have more questions coming in. Great questions, Fulton High School. Emily with William Chrisman in Independence, Missouri has a question. Does a midwife have to know anything regarding surgical nursing?
Yes. So a midwife works in our labor and delivery area. And they do need to be knowledgeable about those GYN cases. And so they do get that through their training, but that is a very important aspect.
Excellent. Thanks, Emily, for asking that question. We have another question that came in. From a student, anonymous, how do you promote healing to patients? Good question. And what helped you advance in your career?
Sure, great question. So promoting healing to patients, it actually starts outside of the hospital. And that's why SSM has been such a great place to work, because we go out into the community. We help meet needs at that community level. Part of bringing someone to wellness is stopping them from coming to a hospital, being able to provide them care in a space that prevents them from ever having to need a nurse to be at their bedside daily. And so we do that through teaching, especially in the nursing profession. There's a lot of education that goes into that, teaching them how to take their medications on time, teaching them what nutritious foods are, and how to care for their disease processes. So it's incredibly important as a nurse to use that tool of education with our patients, and also be out in the communities providing that education.
Fantastic. We have a couple more questions coming in. Actually, Tori from Versailles High School asked, does SSM Health use registered nurses out of state like they use nurses in state? Getting at the travel nurse question. Good question, Tori.
That is a great question. So SSM does use travel nursing to help fill some of our staffing needs. SSM also offers a travel nursing option within SSM. We refer to it as a PRN4 position. And so it is a contract that you sign saying that you'll be working a certain amount of hours during a certain time, but you don't necessarily have to leave your local area in order to do it. And so that is an option that's available with SSM Health.
Fantastic. We have one more question. This comes in from an elementary school. Why are your scrubs black or dark blue?
That is a good question. So our scrubs are navy blue for nurses. And what that does is it helps in the hospital for our patients. The reason that all the nurses wear navy blue, all of our imaging spaces wear black, all of our clinical partners, our nurse aides wear a gray color, and that helps the patients identify who we are. They're going to have multiple people coming in their room providing care to them, and it's a good way for our patients to kind of have an understanding of what is this person's role that's here at my bedside. And so it helps to identify us quickly. It also helps in an emergency situation when you have a patient who's not doing well and you have a lot of people that need to come into the room quickly to help provide that care. The color really helps you quickly identify who you need to give direction to and who needs to be doing what in that moment.
Yeah, fantastic. Good question. One more question. Ashley, one of our high school, looks like a college student, asked how many hours would a travel nurse normally work? Good question.
Yeah, so travel nursing actually works off of contracts. And so a travel nurse has to work that into their contract. So some contracts say 36 hours, which is your 3 12-hour shifts. Some contracts say 40 hours. Some say 48 hours. So it really depends on the company that you're working with for travel. With the SSM travel option, that PRN4 option, that is all negotiable in the contract. And so historically, most work at least the full-time hours, which for nursing is that 36 hours, but they can sign up for beyond that, but that all gets negotiated in the contract.
Fantastic. And one last question. Camden Middle School asked again, how many color scrubs are there?
Goodness, there's a lot.
Color of the rainbow, I would say.
There is. We have a color for just about everything you could think of. And so, depending on what department you're in would dictate what color scrubs you wear. Now, we do have a pediatric facility at Cardinal Glennon in the St. Louis area. And at Cardinal Glennon, for the kids, we can run the whole gamut of the rainbow just to keep things fun and exciting for the kids.
Fantastic. Well, Sam, thank you so much for joining us live from SSM Health, and thank you to the entire team there at SSM Health for keeping us safe and healthy.
Thank you so much.